Hi, it's Tom on behalf of Lived Health, and I have bumped into an icon, and that is Professor David Baker, who many of you might know as Mouse Doctor from the MS Research blog. Just to be clear, Professor Baker is a neuroscientist, not a neurologist, so we're going to get him for the really sciencey stuff. And I just wanted to ask him, David, there's so much talk about stem cells and drugs. I know it's heresy because we're in amongst all the drug companies right now, but as a scientist, what's your view on stem cells as an MS treatment?
Okay, so first of all, I've got to say, well, what's a stem cell? And I think the first thing is there are different types of stem cells? Right. And I think some of it is science fantasy and some of it is hard reality.
Right.
And so the scientific fantasy at the moment is the stem cells that you give and they turn into brain cells and they repair. And it may well happen in the future, but at the moment, I don't think we're there because the question is how do you control the stem cell? So I can give you a stem cell. Stem cell can make any of the hundreds of different cells in the body. How do you make it into a cell that you want it to be?
How do I make it decide to become myelin or brain or something?
So it's factors that you have to give it to.
But is that why they give so many? Because they're kind of crossing their fingers that some of them will get the message and do the right thing.
I think some people think that's how it works, and I think experimentally, when you look at how things work, most of what we've shown in the past is it works by affecting the immune system. And there is a different type of stem cell. So we've got stem cells which create a new immune system. They're the ones that clearly work. I don't think anybody can deny that they work. It's just a question of how can they be delivered in a safe enough way. And essentially what you do is you either try and replace the immune system with a new immune system.
Which is what happens now, isn't it? Essentially a reboot.
Yeah. And the thing that I still think is an issue is whether it can scrub the brain clean. So because most of the drugs that you use to prepare the body for the stem cells probably don't have an action in the brain, and therefore...
So you mean the chemo, the cyclophosphamide? So
cyclophosphamide can get in the brain, but it can only kill kind of dividing cells, and certain cells won't divide, so they're going to be immune to that. So if you leave something still burning on in your brain, then of course it may not give you the optimal.
You haven't put the fire out properly.
Yeah, but it will stop, the attacks and do it very well at the end.
But let me turn this round, and you don't want to answer it. I don't get it. But you were to be diagnosed, and your neuro came along and said, "David, bad news." And would you say sign me up for stem cells, or would you say sign me up for a drug therapy?
I'd have to think about it, to be honest. It's obviously circumstance. I think one thing I may think, if I'm a female, what's it going to do to my reproductive ability? Potentially even a male, but you can obviously bang eggs and stuff. Sure. So that's obviously one condition that you have to think about. What's the process? What's the risk? Are you a risk taker? But I certainly would consider it. So,
so it would be on your list of, I may want to go down this route or this, but it's not written off.
No, it's certainly not written off, and obviously the downside, of course, is how you get access to it. And you can get access to it via the NHS, but you've got to have failed all the treatments to go through that process. And of course, that's, I think, where it's kind of wrong. Really, I think at the end of the day, one takes the risk, and therefore one has to make the decision. And ideally,
the first thing, folks, you've got to be ill enough to get the good stuff.
Yeah.
And by the way, when you're that ill, you aren't going to undo the damage.
Yeah.
That ship has sailed.
Yeah.
So
So I'm a firm believer of hard and early, and be as effective as you can. Now, obviously, the question is whether there's proof that that there is a difference, and is there a real advantage? Now, I think today we're going to hear that when they do a comparison, looking at people who've had stem cells and then they've picked up people with MS who've got similar characteristics and say, well, if I have one of the drugs, do I do better or do I do no worse? And I think what they're going to say is there is no kind of added benefit. However, if you look at the biology, you're targeting a population of cells with your drugs, whereas you're targeting all of them with your stem cell therapy. So logically, to me, it should be better.
So guided missile versus nuclear weapon.
Yeah.
Okay.
You know, and that's the issue, isn't it? It's the nuclear weapon, and if you need, you know, your troops to fight infection, and that's always the balance. It's you know, the real danger with stem cell therapy is infection, and it's those early weeks, months.
Once you drop the nuke, nobody else can go there, can they? So it's
Well, you say that. I mean, there are people who've had numerous stem cell transplants. So stem cell transplants don't mean to say
it's not the one and only, and that's it. Pack your bags.
Yeah,
You're done.
I've heard of a really interesting case where somebody actually had three.
Wow. 3 stem cells.
So the first ones were their own cells. That failed.
Autologous.
Autologous, yeah. The second one was autologous. And then the third one was actually allogeneic. And the reason why that's potentially interesting.
Allogeneic is where you get essentially someone else's stem cells.
Yeah. And so what you do is you will then react against your own immune system. So the transplant will then reject all your immune system. So you actually then really do clear it, and that theoretically can get in the brain, because those cells can go anywhere in the body.
But when you have that, you then need to be on some sort of it's like having a kidney transplant or something. You know, the anti-rejection drugs. You know, the rest of your life. So it's a balance. It's like your answer to would I have stem cells. It depends.
Yeah. And maybe you could then go back and have your own stem cells put in. You know,
David, I know we doorstep you, and I really appreciate your time.
Yeah.
And it's a really interesting take to get the non-medics take. Thank you very much.
My pleasure.
Lived Health will be bringing you on-the-day highlights from Europe's biggest annual MS conference, ECTRIMS 2022. Make sure you're subscribed so that you don't miss out on the latest updates in MS treatment from across the globe.